Hello, I'm back again, Melissa Timmons with System Education. I'm here to talk a little bit about incivility and conflict. So when I say these words, what do they mean to you? What comes to mind? I think I would agree with some of those things that you're thinking of. Incivility is when someone is rude, impolite, disrespectful, may or may not have a negative purpose. Now, the American Nurses Association defines bullying as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. And incivility is another term that's used to describe mistreatment or discourtesy to another person. It lives on a continuum. So at one end of the spectrum, we have eye rolling and nonverbal behaviors, sarcastic comments, rumors. And on the other end of the spectrum, we have physical violence and intimidation. Essentially, incivility is bullying or workplace violence, which is unacceptable. There are 4 types of workplace violence, but lateral violence and customer violence are the most common. So what are some common causes of conflict that you may have noticed or seen? Just thinking about what are some reasons? What's the real root cause? So I have a few listed here. Diversity, lots of diversity considerations. So I've got gender and culture and age, but there's also other types of diversity, different types of thinking, different religious practices, different cultures, different traditions, different values that somebody may have and how they care for others and how they interact with others, what their work ethic is. Poor communication or unclear expectations is a huge cause of conflict. In a study by Albert Moravian, it identified that communication is 7% of the words that we say, 38% by our tone, and 55% alone just in our body language, our nonverbal communication. So in looking at that, you can see that 93% of our communication is everything but the words that are actually being said. That's a lot of communication. Other challenges with expectations and communications can definitely stem from staffing, which when you think about it, whether or not we're in these times that we're currently in, but if you're working under distress, if you're working with a different workload, or you feel overworked or frustrated by some challenges within your work environment, that's going to create and increase the probability of conflict. Individual behavior can be incompatibilities, misperceptions, just different temperaments, different personalities, different ways of interacting with others. So there's a lot of variability when it comes to just individual ways of interacting. These causes of incivility and conflict are important. So when you think about it, why are they so important? Why do our work relationships matter so much? When we treat each other with dignity and respect, the people that we serve will feel the trust that we have between us. These individuals receiving services get a sense for that they're safe with us and that we're safe with each other. And the more that they feel that they're safe, then they're going to act safe and they're going to feel more receptive to our interventions and more compliant, more understanding of why we have the policies and procedures that we do or why our organization is structured the way it is. So they feel that trust. So if there is distrust and miscommunication among staff members and colleagues and interacting with other areas and individuals, the patients pick up on that, whether it's something that's kind of obvious or whether it's kind of the dynamics that they're just so in tune to or that they overhear. So we become that decisive element in our environment. We become empowered by the opportunity to really address and really be intentional with how we might handle situations that we disagree with. And those disagreements are opportunities for us to collaborate and identify potential benefits on behalf of the patient. So it doesn't necessarily mean anything bad, but it's kind of, what does that conflict, what can it create? What can the outcomes include? Positive and maybe not so positive. So first we define that conflict. And as we talked about the different causes of conflict, really understanding those root causes gives us insight into certain situations. So in order to then explore what those outcomes will be, we look at those causes. So as this particular image talks about miscommunication, misperception, and then just flat out disagreement. Now, as I talked about, really miscommunication and misperception, you guys, when you think about that, you have potential there. You have opportunities to really see, okay, I thought I said it one way and that was not my intent. Or, my perception was you did this and this. So oftentimes when we really understand how somebody is coming across or, approach somebody that we're having conflict with, the miscommunication and that misperception can be resolved. I think the bigger challenge that we're often faced with is disagreement. I think it should be one way, you think it should be another way. That's where we really utilize certain conflict resolution strategies. So before we get to that part, let's think about the different types of conflict. So we know that they have different roots to the conflict, but what about the structure of how conflict evolves or presents itself? So conflict typically occurs in three ways as far as how you might see it. So intrapersonal conflict is where an individual has an internal struggle with a type of situation or values or wants. So you've got these conflicting or contradictory values or wants. So this could be something like, I am working to try to be open and honest, as I'm interacting with my patients, but that's sometimes in conflict with me trying to be kind and helpful and come across as caring, as it might be misunderstood. Okay, so that might be a type of intrapersonal conflict that I have within myself. Interpersonal conflict occurs when you have two or more people with differing values, beliefs, goals, all those kind of differences that we talked about. So if you have interpersonal conflict, it could be a situation where I think we should use this equipment for this patient in order to lift them from the bed to the chair, and you think, no, we don't need to do that, and we should just use this type of equipment. So it could be something very straightforward and just disagreeing on how we might intervene within a patient's plan of care. Intergroup conflict occurs between two or more groups of people, also be departments, organizations, areas of practice that we work in, different disciplines. So an example of this might even be difference in groups of day shift versus night shift, or one unit and another unit, or it could be even specific departments and areas of practice, or even different entities in conflict with each other. So that could be quite a big group when you think about the different types of entities and areas and facilities that people work in. So that's an intergroup conflict. So 5 ways that conflict could be resolved in. Okay, so when you look at this, which ones would you really think could be beneficial? Okay, so if we want to try to identify which one works best and which ones would we really want to stay away from, now to have a positive, constructive working environment, it is best to avoid avoidance. Okay, so lose-lose conflict resolution outcomes can really deteriorate the work environment, working relationship that we have with our patients. So that one's a big challenge, and it becomes where it can snowball really easily if we just avoid. Okay. So what we want to ultimately strive for on the opposite end is really that collaboration. We want to identify opportunities where everyone's needs are met. I get what I want, you get what you want, and whether or not we're talking about, interpersonal conflict, intergroup conflict, maybe I'm, resolving something within myself, I want to feel like this is the best resolution possible. And these types of win-win conflict resolution outcomes can really help build relationships. It really works very synergistically, and we're all like, oh, rainbows and butterflies are appearing. So that's really where the magic happens, is with that collaboration. And I don't know about you, but I know for the longest time, I thought compromise sounded like a pretty great deal. But turns out, if you give in over time, give in, you feel a little bit unheard. You don't feel like your opinion is valued, or that you're productive, or that people care or want to listen about what you have to say. So that can really deteriorate that relationship over time, whether or not we're talking about, in a shift I'm working, or, over weeks or months that I'm working in an area or with individuals, or maybe I'm seeing specific clients on a routine basis because they have follow-up appointments. So over time, that can be very challenging. So, we want to really strive for win-win. So I'll tell you guys, one way that we can really help to manage and develop the conflict resolution into a collaboration is where we can really work together to identify a shared goal that we both agree on. So I think it should be one way, you think it should be another, but what if we took a step back from that and really thought about, what do we both think would be really great? And oftentimes, you guys, just in the work that I've done with patients and working with colleagues, especially in behavioral health, it all boils down to safety. I want to be safe. You want to be safe. I want you safe. All these things. And doesn't that sound great? And they're like, oh yeah, that actually would be kind of a nice thing. Okay, so, how can we together, if that's our purpose, if that's our goal, it's less of a power struggle to try to figure out how we get there. And that takes a lot of patience for our patients, especially when we're talking about, fast paced, very quick. We've got to figure this out. We've got to, be productive. We got to kind of move forward. That takes a lot of time sometimes, and that can be really challenging to allow for that process to happen. So, there are ways to expedite that a little bit. We can already have, really great ideas and strategies and really become good at this part. And then it becomes easier and easier because we have those experiences. We have those lived experiences that we can draw from to help us understand, okay, last time when I did this, this is what worked out really well. So hear me out. What do you think about this? Okay, and so really helping to bring people on board through that process can make it a win-win situation. So what do you think about these? I know you guys have seen these before. Assertive communication sometimes gets a bad rep. I'm telling you, by definition, assertive communication is great. It's good, it's helpful. Being assertive means you are communicating your perspective, your thoughts, while respecting the rights of others, which means you're not intimidating, you're not putting people down, you're not making them feel bad. You're like, okay, you're actively listening, you're hearing them, you're, giving some paralanguage, acknowledgement and validation. I hear what you're saying, but I'm going to think about that in a different way. This is how I notice it, or this is what I feel like may work best in this situation. What do you think? So it's okay that we disagree. How do we get to the point where we can resolve that conflict, right? So these are the things to think about as you're working with your orientee, your preceptee. How can you help them think through those same situations and deal with conflict that they experience? Maybe it's conflict with colleagues, or maybe it's conflict with other areas or within themselves, right? So there's lots of different types we've talked about. So how can we help them with that? Really being intentional. Using I language or I statements versus you language. So it's more about I and less about you, which seems the opposite of what we normally think about, right? There's no I in team, but there is I language. So you language is what you would say, you always do this or you never do that. It's a lot of finger pointing, you guys, right? So when that happens, the person really becomes defensive, and that breaks down opportunities to collaborate and to be constructive in that conflict. So I language phrases it in a way that allows them to hear and know what you're thinking and feeling, and then they can also use I language to reciprocate. So I feel this way, or I think this way, or I notice this. So you're speaking from your own perspective and you're not overgeneralizing it or jumping to conclusions. Because, we could tell ourselves a big story and you never do this because you're lazy and you never want to help out, or you're malingering and you never are compliant, and all this stuff. That didn't feel good even just to say it. So how can we really switch it in order for us to be able to still say what we feel like needs to be said in that situation and allows for opportunity for that conversation and for resolution? I language is the ticket, you guys. The more you practice it, the easier it becomes and the more genuine it is. When you just read it or think about it on the surface, you're like, that sounds really, really kind of hooey. I don't know if I could do that. But I promise you, the more comfortable you are and the more you use it, it feels more natural and it comes across really well. Okay, so sodas is another type of resolution strategy. So there's, when you do your research, you can find about a bazillion different problem-solving model strategies. There's an acronym for everything these days, and here's one for problem solving using the acronym SOTAS. So it stands for situation, options, disadvantages, advantages, and solutions. So we'll talk a little bit more about that on the next slide. So think about that. And also, I know you guys have seen the last model: listen, apologize, solve, and thank. And maybe you're familiar as well with the CUS model. So last is used as a really positive customer service model that we can help communicate when individuals are concerned or express disagreement or can become escalated. So the CUS model is another type of strategy that we can use. It gives us terms, it gives us words that we can say in order to help us communicate the seriousness of a situation. So as you guys probably know, CUS stands for, so hey, we can cuss at work. I didn't realize. Yes, indeed. Okay, no, here we're here in just this way, right? So we can use the CUS model because I'm concerned. I'm uncomfortable. I feel like this is a safety issue. So concerned, uncomfortable, and safety. I've got that on our next slide. Absolutely. So here we are. I feel concerned about this patient's condition, and I'm uncomfortable because I think this could be a safety issue where they're going to desat or they're going to have an exacerbation of symptoms such as. So these are just words, again, that we can use in order to help communicate our concerns and our thoughts about a situation. So we can see here about SOTAs. Really helps us formally think through a situation or a problem. So we look at the root cause of incivility, and we talked about all those different kind of ways that that might present itself as conflict and incivility. So how do we address it? What are our options? So I can think of a couple. And if you felt safe and you weren't feeling threatened, could you address that conflict with that individual directly? Sure. If that was the option, let's pro-con that, right? Let's look at the advantages and disadvantages of that option. Oh, okay, well, if I could approach them, but what if they get even more upset? Or what if they lash out? Or what if they become aggressive, right? Okay, that's a concern. All right, so the option of addressing them specifically one-on-one. What else could I do? Well, I could report my concerns to my charge nurse or my lead individual, my lead supervisor, or maybe the house supervisor or my manager or my direct report. So, we have lots of options that sometimes we have this, what's called dichotomous thinking. It could either go this way or this way, and there's no in between. Where's the gray, right? Where's the other option? So that's really what we miss sometimes, especially when we're in the heat of the moment. I'm trying to think through what else we could do, but that's difficult. It's difficult for anybody when they're feeling the pressure, they're feeling frustrated or anxious or upset, right? That's kind of our fight or flight response that really triggers our amygdala, that fear response, and that fight or flight. When that happens, you guys, our ability to reason and compromise and think through situations very rationally and intentionally is hard. So we really are trying to kind of slow that down and be intentional and be productive. So we pro-con all of the options, and then we just identify what's the solution that's going to work best for everyone. And that's, again, kind of where that collaboration can really make a difference. What do we both agree on? What do we both want out of this? Or what do we as a group want out of this? And you know what? And then we give it a go, and we try that, and we see if it works. We review those results. So a couple of other tools, and you're like, there's acronyms for everything. And yes, there are. So here are a few more to really just think through. And, any of these strategies that kind of speak to you, you're like, that's the one. That's the one I think that will stick with me. It's all about what you can remember and what just clicks for you. So think about these. There's one that's called the ABC, and that's thinking about antecedent behavior and consequences. So what is the root cause? Again, understanding, what's behind this. And I will tell you guys, you'll do yourself a favor if you ask yourself that question, no matter what the tool or acronym is that you use. It's kind of, where is this coming from? What is this all about? Because we might not see the full picture, the full story. But if we give ourselves pause and not just think of the negative side of that, but also think about, well, maybe there's more going on that I don't understand or they don't realize. And how are they acting uncivil? Not to make excuses, but to understand. Because when we understand, when we call it what it is, then we feel empowered. Then we feel that we can, take it to that next step. Let's address that. Because what will happen if that relationship is not identified, is not resolved, is not addressed, something, right? It can really make a difference in patient care ultimately. Okay, so looking at radar, to me, this is my favorite. I'll just tell you, it's my favorite. I love it, because you can use radar in lots of different situations. We have it in the context of incivility. So it stands for recognize, assess, decide, act, and review results. So when we recognize incivility, that's what that is. The eye rolling, the sarcasm, the rumor spreading. And you guys, those covert types of behaviors are really harder to call out. Maybe harder, to even recognize and notice, but also for some, they may feel more uncomfortable that it's not, they're not abusive, or they're not violent, or they're not, threatening. So I don't know. Maybe it's okay. And I'm here to tell you and support you to say it's not, right? Incivility, bullying are unacceptable behaviors. So how do we address it? We've kind of talked through what are some things that we could do, act on what's decided upon, and then was the issue addressed? Do we feel like it's resolved? What was the outcome? Love, love, love radar. Radar can really help you stay engaged in your environment, to really be in tune to what's going on. And the more that we're engaged and curious and aware of our surroundings, that situational awareness, the more productive and the more intentional we are, and the more opportunities we can be to be proactive, which I love. Love, love. Okay. Thank you guys. I hope this helps, and stay tuned for the next segment.